Dr. Chaka, for those patients who are in the first category and who do need surgery right away, let's just say they have triple negative breast cancer and they've just finished their upfront chemotherapy, or they are in another, for whatever reason, they need to move ahead with their surgery. And let's say that they need to have or have chosen to have mastectomies. How is the reconstruction choices, how have they been affected by the COVID crisis? Can they have the same reconstruction that they wanted to before, or has that also been affected by this situation?
Well, I think this is the one situation that's been affected the most, because currently we are not doing any type of breast reconstruction. And that's pretty much a practice that was, again, put in force by the American College of Surgeons, the American College of Plastic Surgery, because although, up until this time, the two things almost went hand in hand, and we would do immediate reconstruction all the time. We do know that doing breast reconstruction will increase your postoperative complication rate. And it's not to a degree that makes it unsafe, but again, it goes back to the original idea of, figuring out what can wait until afterwards. If you have a patient who's had more surgery, those patients are going to end up being in the hospital for a longer time, again, increasing their exposure. And if those patients develop a complication and on top of that develop coronavirus, that can significantly impact their care, and their ability to not only beat the cancer, but the coronavirus.
I see. And so for those patients who have mastectomies without reconstruction, they can plan their plastic surgical, steps at a later time to make a plan for that. Or any of those patients, can they have, let's say, the placement of a tissue expander at the time of mastectomies, and that being sort of a holding pattern until they have their final steps later on?
Basically, the recommendation is to even hold off on doing a tissue expander. Because again, we consider that to be very safe, but there are some issues that can arise in the post-operative period that can put the patient at risk. If you have a patient who's going to require post-mastectomy radiation, that's still sometimes the case when needing radiation after a patient has had a mastectomy. We may consider putting the tissue expander in, but pretty much at this point, if a patient needs to have a mastectomy, we're only doing the mastectomy or trying to come up with a way that we can delay the surgery altogether until after the pandemic is over.